Okay, so let's get into the treatment for anxiety, phobias, addictions. All of these are what's known as behavioral therapy. So here's the exciting part. It's not really exciting, but it's beneficial. You have to understand behaviorism as a field of study to understand behavioral approaches to therapy. So, allow me to review. Some of you still don't know who John Watson is. You don't know who B.F. Skinner is. You don't know who Thorndike is. And you don't know what operant versus classical conditioning is. So, fear not, my friends. Allow me to shed some insight on this. So, just as a brief overview of where we came from in the last section, it was the idea that the original psychotherapy was psychoanalysis, right? So Freud, you lay down on a couch and he hypnotizes you, or he has you free associate and interprets your dreams and tells you about the problems you had with your mother, and et cetera, et cetera, et cetera. So psychoanalysis kind of morphed into psychodynamics, which was more emphasis on the childhood conflicts than it was on the id, the ego, and the superego. But the problem with psychodynamics and psychoanalysis is it's diagnostic. It's about what is the problem, where did it come from. So then out of the Freudian era, by the 1920s, that really was kind of insufficient. People became more aware of psychology as a field, especially therapies. So then it evolved into behaviorism. And this is kind of a carryover from Ivan Pavlov's work in Russia. And then John Watson really replicated Pavlov with the baby Albert experiment, and then psychology's behavioral field exploded from there. What started out as classical conditioning evolves into, extend into operant conditioning and even observational learning. So let's talk about behaviorism for just a second. Behaviorism is important to understand as a field of study because that's how most anxiety, to some extent depression, but not really, anxiety, phobias, addictions, unwanted behaviors, right? That's a behavioral approach. And then in some of these there's an overlap of a cognitive approach. So behaviorism is this idea that there is an association between a stimulus and the resulting response. Stimulus evoking a response. So in classical conditioning, it's accidental. It's subconscious. It's not on purpose, right? Like the idea of like Pavlov's, the scientist would ring the bell, the dog salivates. Well, why do they salivate? Because they're anticipating food. So the bell or the tone was neutral, but it's paired with food, and then all of a sudden they begin to anticipate an outcome, right? It's classical conditioning. Same thing with baby Albert. The idea behind Watson's study was to associate a fear response in neutral objects. So baby Albert would have a fear, let's call it an anxiety attack, when confronted with the furry animals, right? It's classical conditioning. And then you get further studies into animal behavior and things like behavior modification. So you have like E.L. Thorndike, who's training seals, and he's training, animals like dolphins, and he's training cats in his operant chamber. And the idea behind operant conditioning is behaviors directly lead to outcomes. So behaviors that are reinforced will continue. Behaviors that are not reinforced or punished will stop. So now let's take the behavioral approach of Skinner and let's apply that to anxiety, or let's apply that to phobias, or let's apply that to addictions. If you start, let's say, drinking alcohol as a way to self-medicate, and the alcohol has the desired emotional effect, then the behavior of drinking alcohol is being reinforced because the outcome is desirable. And that's how addictions happen, right? It's the dopamine reward pathway of, I participate in this behavior, like drink liquid equals feel good. Drink liquid equals feel good. Drink liquid equals feel good. And then it becomes this anticipation. I feel bad and I need to feel good, I can drink liquid, right? That's how addictions happen. So if addictions are conditioned into a person, it stands to reason that they can be conditioned back out of a person. So the first thing I want you to think about with the behavioral approach to addictions, phobias, anxiety, is this idea of counterconditioning. Right? That is like your banner term at the top there, counterconditioning. Counterconditioning is not eliminating a fear response or eliminating an addictive desire. It's reconditioning with something that's a little bit more positive, we'll say, right? Something that's more desirable, right? So counter-conditioning, that's at the top. Put that at the top. Everything else is going to be examples of, right? So let's get into counter-conditioning. We talked about the difference between psychodynamics, which is Freudian psychoanalysis, and humanism. So we'll get back into humanism in a minute, right? But let's look at behaviorism, right? Behavioral therapy. Behavioral therapy is the idea that behaviors need to stop, so we're going to condition them back out, right? The same thing is true when we add cognition to it, right? Cognitive behavioral therapy. What if it's a thought process that's driving the behavior, and that needs to stop? Well, then we need to address the cognitive processes so we can address the behaviors so we can get a desired outcome. So let's think about it this way. Right, I like this cartoon as a good example of Freudian psychodynamics or psychoanalysis compared to humanism, right? A behavioral therapist, somebody like, I mean, humanism could be behavioral, it doesn't have to be behavioral, but specifically somebody like Watson or Skinner, right? So if you've had a hard time understanding this behavioral concept of, right, behaviors without cognition, and you're like, why does that make any sense? It's not like Watson didn't think that people had feelings or thoughts or emotions. It's just a different approach to scientifically testing things, right? So for instance, if you look at the car as like a metaphor for your psychological problem, right? The hood is up, there's obviously something wrong with the engine. So the Freudian psychologist, his thought bubble says, what's the nature of the trouble and when did it begin, right? So that's your Freudian mechanic. And then your behavioral therapist says, let's drive it around and see what happens, right? It's all about actions. Actions and responses, actions and responses. So when you think behaviorism, think Skinner, right? He's training rats, he's training pigeons. How is he training them? By rewarding behaviors or withholding rewards for behaviors, right? Think of Watson. He's associating a fear response with unrelated animals, right? That's what we think of when we think of behaviorism. And you say, okay, well, I thought behaviorism was limited. What's the problem, right? We have a whole lecture, this behaviorism and the limits of behaviorism and anxiety. So why is behaviorism a technique or tool for eliminating anxiety? Well, you have to think about it this way. The behavioral approach isn't usually a standalone approach, right? We talked about the eclectic approach. A lot of times it takes cognition and behavioral approaches. But the behavioral approach as a therapy would work for addictive behaviors or behaviors that you want to stop. In some instances, it may work in anxiety, but let's assume that your anxiety trigger is not the result of a behavior, it's the result of a thought process or an anticipation, right, a control issue. So let's look at this. Let's assume that there are behaviors that are maladaptive and that they are learned. You say, well, what do you mean by maladaptive? Well, those are things that are destructive instead of constructive, right? So if maladaptive behaviors are learned, just like Pavlov's dogs, right? What happens? He rings the tone, then he sends in the food, he rings the tone, then he sends in the food, he rings the tone, he sends in the food. What happens? The dog begins to anticipate the food when he hears the tone. This is sometimes how anxiety triggers happen. Think about PTSD. PTSD is a good example of conditioning. Let's say you get into a car accident, and now all of a sudden you have a conditioned fear of riding in cars. Well, it was a behavior, an action, that you associated the outcome with. I got in the car, I got into an accident, I got injured and was afraid. So now you begin to generalize your fear to all cars or car rides, right? So PTSD is a form of behaviorism, right? So if your fear response or your anxiety trigger is a car from a car accident, that was conditioned into you, right? A flashbulb memory, an instant post-traumatic event, we'll say. So if that was conditioned into you, then we need to counter-condition that back out. And you can't always extinct the trigger, right? So here's an important thought. The goal in any anxiety training is not to eliminate the trigger. The goal for overcoming anxiety is to learn mechanisms to cope with the trigger. And that's an important distinguishment, right? It's not as if your anxiety trigger is just going to go away. It's not the best way to treat anxiety, by removing anxiety from your life, right? So for instance, we saw that TED Talk on Friday with the woman who was from New York, and her family moved her to Florida, down in Miami, and she was going to the Catholic school down there, and she was having a hard time because the teacher and her peers were making fun of her New York accent, and she wanted to go back to New York, and she kept asking her mom, can we go back to my old school? Can we go back to Manhattan? And the mom gave her this clever, like, mom ruse of, oh yeah, well, the Archdiocese is getting involved, and we're trying to find a spot for you in the school, and we'll keep you posted. Keep going to school. And in that TED Talk, the woman mentioned her studies with exposure therapies for people with anxiety. And I'm going to use that as an example, right? But here's the other thing. Remember back a couple weeks ago when we talked about how suffering is something that's uncomfortable. It's something that we don't like. And out of self-preservation, if given the option, we're not going to allow ourselves to suffer, right? So let's give the example that she gave. What if a child is deathly afraid of needles and injections? Well, when it comes time to get your vaccinations, if you give the child a choice of shot versus no shot, obviously they're not going to take the shot. So out of a self-preservation desire to avoid suffering, you would choose something that's ultimately harmful to you. See how that works? You're going to avoid suffering in the moment, but that's actually going to cause issues in the future. So we can't trust our emotions and instincts all the time, because out of self-preservation, we're going to avoid suffering at all costs. But sometimes it's necessary to suffer. Sometimes we have to do things that we don't want to do, or that we're uncomfortable doing. So we have to learn how to face these fears. That's the whole point of anxiety training. That's the whole point of children, right? In that TED Talk, she gave the Alfred Adler, who was a neo-Freudian, by the way, but he was a psychotherapist for families and children. And Adler was the one who came up with the birth order theory, the inferiority complex, the superiority complex. That was Adler. So it was Adler that said your job from the time that your child is little is to make them self-sufficient, to teach them to self-efface is the word, right? Self-efficacy. To make them independent as opposed to being dependent on you. So what happens if the woman if her parents did not force her to go through the undesirable suffering? Well, then she would never get vaccinated. What happens if her parents pulled her out of school because she didn't like it there? Well, it would eliminate the anxiety trigger in the short term, but she would never learn coping mechanisms. So it's important for you to understand that sometimes the best way to treat anxiety is through an exposure therapy. Now, I'm going to caution you, it doesn't necessarily mean we go full bore, right? We just jump right in with both feet, right? If it's a small type of anxiety, if it's like a simple hesitation that you have, yeah, maybe you jump in with both feet. That's a type of exposure therapy. Like maybe you have to give a speech at graduation and you're super stressed about it. Well, you just may have to do it. I mean, you just may have to get up there on the stage and find a spot to stare out at the crowd and just suffer through your anxiety for 2.5 minutes and then go sit back down and be comfortable again. But what if you have panic attacks when you get on airplanes? Well, it's probably not the best strategy to go take a 5-hour flight on an airplane. That's not going to help you. I mean, maybe it will if you overcome your fear, but there's different ways to treat anxiety triggers is my point. There's different ways to do it. So let's look at the ways that behavioral therapists can use counterconditioning to treat anxiety, phobias, and even addictive behaviors, right? So there's singular therapies and there's group therapies, right? So for instance, like an example of group therapy for your addictions would be like Alcoholics Anonymous, right? It's a support system. An example of a singular therapy for addictions to alcohol would be something like aversive conditioning. There's different types. So let's go through the vocab and help you like pick them all apart, right? So phobias might be conditioned, because here's the thing, if they're instinctive, they're probably not a phobia. So people say things to me like, well, I have a fear of heights. Well, that's normal. That's natural human behavior. Congratulations for you, your amygdala works. Because it's not that you're afraid of heights that's the problem. It's to what extent are you afraid of heights that's the problem. right? Is it because you're standing on the first rung of a ladder and you're 8 inches off the ground that you're afraid of heights? Well, that's irrational. That's a phobia. But if you're 40 feet in the air on the balcony of a, a condo, that's probably pretty rational. Because you instinctively know that if I fall from here, I very likely will die. It's not irrational to have a fear of heights from 40 feet in the air. It's irrational to have a fear of heights from 3 feet in the air, right? So what makes a phobia rational or irrational as opposed to a fear, which is rational? It is the fact that it does not pose any imminent danger to you, yet still you are debilitated by a fear of it, right? It's not a natural, instinctive fear. So your fear of spiders may actually be pretty rational. Your fear of snakes may be pretty rational because there's this instinctive aversion to snakes because snakes can potentially harm you, maybe even kill you, right? If you have an irrational level of fear of spiders to where you can't see an illustration of a spider or Halloween decorations of spiders or cartoon spiders or anything that's remotely shaped like a spider, yeah, that might be irrational, right? So it's not the fear itself that's irrational. It's to what level does this cause a panic attack or an anxiety attack, right? So let's get into counterconditioning. That's a vocab word. That's kind of the banner here. That's the umbrella term. This is a set of behavioral techniques. There's several examples of counterconditioning. So the idea is if a behavior is conditioned into you, it can be counterconditioned, right? So if you've been conditioned to fear riding in cars, we can help you counter-condition that fear so that you can get back in the car and you can ride around. So this is strategic. I don't know what word I was trying to say. This is specifically a behavioral technique. This is something that would work maybe with specific phobias or specific anxiety triggers, but it's probably not the best approach for anxiety. I mean, you would also want to add some cognitive therapy in there too. So cognitive behavioral therapy is a combination of cognitive psychology, behavioral techniques, and that's a therapeutic approach. So let's look at counter-conditioning as if we're treating phobias, addictions, anxieties, right? So there are different types of counter-conditioning. Let's put them in 2 categories. You have exposure therapy. That's one type of counter-conditioning. And then you have aversive conditioning. Exposure therapy and aversive conditioning. That's kind of 2 subcategories of the ways to counter out a conditioned response, we'll say. So let's talk about exposure therapy first. Exposure therapy can be as simple as child's afraid to jump off the dock. So what do? Make them face their fear. Push them off the dock. Now, maybe that causes a panic attack and it makes them resentful and they never want to jump off the dock again. Oops, that backfired. In all likelihood, it probably won't because the level of terror they're going to experience is not ultimately traumatic. Now, if you were on a bridge and afraid to jump off, yeah, that might have a traumatic impact on you. So again, the intensity of the fear response is probably going to determine what's the best approach here. Having a fear of spiders might be debilitating. So they can't just surprise, look at your left shoulder, there's a tarantula. You might freak out and have an anxiety attack. So the point I'm making is this. It's up to the therapist to determine what is the correct approach to your anxiety or your phobia or your addiction. So for instance, the most likely type of exposure therapy that's used to treat anxiety is what's known as systematic desensitization. That's a lot of syllables, but it helps you understand exactly specifically what the term means. Systematic desensitization. So break the word down in your mind, it means exactly what you think. We're methodically, step by step, hierarchically, if we can make that an adjective, desensitizing you to an anxiety trigger. So let's say, for instance, you have a fear of school. Well, is it the building? Is it the people? Is it a specific incident that happened at school? Is it a place on campus? So even a specific anxiety trigger is not really that specific. I'll give you an example. So a lot of behavioral therapists look at this as a hierarchy of anxiety triggers, right? So at the ultimate center of your fear of school, let's say that you have some anxiety that when you come into school, it might actually be the cafeteria, right? It's chaotic. There's a lot of people in there. There was a painful incident that happened in 9th grade. Maybe there's, like people that you just don't enjoy being around that sit at the end of your table. It's just not a good experience for you. So it's not school so much that triggers your anxiety. Because if you walk into the empty building, you may be fine. But it's the cafeteria in the school. So that's the ultimate source of your stress. The ultimate source of your anxiety, in this example, we'll say, hypothetically. So that would be at the heart of your anxiety. But then you might have a hierarchy. You may generalize, right? So you know that when you're walking down that science hallway heading towards the cafeteria, you start to get this buildup of panic because you're getting ready to walk into a crowded cafeteria. So in the hierarchy of anxiety triggers, you have the cafeteria, then you have the hallway leading up to the cafeteria. You might even have the entrance to the main building because that's how you get to the hallway, which leads to the cafeteria. You may have the walk down the main hall. So again, that's a hierarchical level of anxiety triggers. So, and that matters. You might say, well, we're splitting hairs here. Well, we're not, because in a systematic desensitization process, you have to slowly approach each of the levels of the hierarchy. We're not going to start with the crowded cafeteria. We're going to start with the empty hallway that leads up to the cafeteria. And when you feel that panic response, maybe that's enough for today and we'll move. Right? We're going to talk our way through it. What is it that you're feeling? I'm starting to get anxious. Okay? And they teach you a coping strategy, a relaxation strategy. So as you feel anxiety walking through this open, empty hallway, I want you to go through your coping strategies that we taught you. Right? And maybe it's counting, maybe it's recognizing things on the wall, maybe it's giving yourself an inner monologue speech, whatever it is, whatever the coping strategy that your therapist teaches you. So you're fighting off the anxiety by learning to relax, but it's slow, and it's methodical, and it's increasingly closer and closer to the actual trigger, right? And eventually we might make our way into the cafeteria, but it'll be the empty cafeteria, and maybe you just go into the doorway, right? And when it becomes overwhelming, we come back out of it. Maybe you get to where you can sit down on an empty stool on one of the tables, and maybe you can eat a meal there. Maybe we add some people that are friends that are close to you. And every time you feel that anxiety start to well up, you go through your coping strategies. And the idea is to desensitize you to the emotional trigger that causes the anxiety. It's a coping strategy. It's a coping strategy. Now, let's look at a lesser example. It's not so much systematic desensitization, but this is one you might have some experience with. I mentioned this example before. If you babysit or you watch little kids, right, or you have any access to little kids at all, you know that kids are prone to throwing fits, right? Well, think about why kids are hyper-emotional. They're hyper-emotional not because they're trying to get what they want necessarily. That could be an option. Maybe they're hyper-emotional because they're actually struggling with the idea of disappointment, right? So think about this, right? We mentioned the kid with the iPads, right? All the kids with the iPads, don't mess with them. Don't take the iPads away. They'll freak out. So taking away the iPad from the kid, and the kid freaks out and throws a fit. Well, let's think about emotionally what's going on. The kid is ultimately upset because they lost their iPad, but not really, right? They're upset because now they're being forced to do something that they don't want to do, right? It's no different than if the kid asks you for ice cream for dinner. Hey, can we have ice cream for dinner? Mom's gone. No, you can't have ice cream for dinner. And they freak out and throw a fit. Well, the behaviorist would say, that behavior is inappropriate. We need it to stop. Let's modify the behavior. And that's not wrong. They can't act like that. That's inappropriate behavior. The behavior needs to be corrected. But what's the best way to correct the behavior? It's not by making a scene. It's not by matching emotion with emotion. No, it's by removing them from the place where they get attention, negative or positive attention, right? Because maybe they're just trying to make a scene. Getting them in a place that's safe, a place where you can calm them down away from their emotional state, get them back into their logical conscious state. And this is what people think that's soft. Well, safe spaces, that's soft. Well, it's not, because you're not actually coddling the child. Coddling the child will be giving in and reinforcing that behavior. It's actually the opposite of that. What you're doing is you're empathizing with the child because they're learning how to deal with disappointment. So you're teaching them coping strategies to deal with disappointment. It's the whole idea behind conscious discipline. If you look into conscious discipline, it's this idea that when little kids in school settings throw a fit, you don't take things away from them. You give them a safe place to wade through their emotions, because the reality is they have to learn to deal with disappointment. Now, what would make it soft, quote unquote, would be giving in. Then you're actually just reinforcing the behavior, because then the child isn't dealing with disappointment. They're punishing you by screaming. And if they punish you by screaming and then you give them what they want, it just reinforces the behavior, right? So it's behaviorism. So there's a level of this where it's psychologically important to understand exactly what's going on here. Why is this child so upset? It could be because they're a pain in the ass, right? Or it could be that they're emotionally dealing with this temporary trauma of disappointment. So teaching them how to cope is the best thing you can do. And it's a process, though. It's a lot easier just to give them their iPad back so they don't freak out. But the reality is that you have to train behaviors, but you also have to teach coping mechanisms to deal with disappointment. Because someday it won't be eating ice cream for dinner. Someday it won't be getting the iPad at the restaurant. Someday it'll be whether or not they get into Florida. Too soon, too close to home, right? And I don't say that lightly. Someday it will be the fact that someone that they really care about rejects them, or they suffer some kind of loss, or they don't get the job that they want. People have to learn how to cope with disappointing emotions. Yes?
So if you're trying to give someone a mechanism that is constantly being used, what does that do?
Well, that's the key. So I like what you said. If you're giving someone, if instead, let's say instead of a coping mechanism, all you're doing is reinforcing their bad behavior, right? So that's where some people kind of lose the idea of conscious discipline. They say, well, wait a minute. If I go and take my kid to the side and emotionally calm them down every time they throw a fit, all I'm doing is teaching them if they want attention from me to throw a fit. Well, the idea there is that there's a developmentally appropriate level, well, let's say a level of development where it's appropriate to do that for a child, right? When you're 17 years old, you shouldn't still have to go to safe spaces, hopefully, right? That's the thing about this narrative where people got bent out of shape about safe spaces on college campuses. The idea is not a bad idea. It's just that at that level of cognitive development in your life, you should be able to cope without having to go to a safe location. The safe spaces are about teaching little kids in a non-threatening environment how to process their emotions when they're triggered. So it's not that adults don't get triggered, they do. But hopefully by 18, 19, 20, 22, 25, 30, they don't become so triggered that they have a panic attack. They have learned how to cope. So yes, if we're not careful, we can reinforce bad behaviors by constantly giving people the attention that they seek. And that's the problem with permissive parenting. All right, authoritarian parenting doesn't work because you're basically teaching your children, oh, you can't do it because it's my house, my rules, and as long as you're under my roof, you're going to do what I want. Well, all the kids are hearing from that is, well, I can't do heroin because Dad doesn't want me to, right? And that's a totally different narrative than I shouldn't do heroin because it's a bad life decision, right? So what happens when my house, my rules parent, and you're no longer in their house under their rules? Well, now, right, the sky's the limit. But on the opposite end of that spectrum, permissive parenting doesn't build coping mechanisms either, because you get constant affirmation from your parents. They're always tiptoeing around your emotions. And so I think the word that I want to use here is resilience, right? If we could, I don't know that it's fair to say this, but if we could pick an opposite word to anxiety, it would be resilience, right? How do we learn how to cope with disappointment? How do we learn how to cope with fear? How do we learn how to cope with emotional triggers? Resilience, right? We have to learn how to overcome things that are just not desirable. So yes, I do think there's some truth to that. I think that if we're not careful, we can reinforce behaviors instead of teach coping skills. I think that should be the goal, right? And I think there's a dialogue that happens there. Like even with a 6-year-old, my middle son is in kindergarten. So even with a 6-year-old, once you get past that emotionality, you can ask him rational questions, right? Like, what is the issue? What are we so upset about here? I can't get my shoes on. It's like something silly like that. Okay, how can we solve the problem? Well, they're tied. Okay, let's untie them, right? So what you're doing out loud seems logical, but you're actually training him. You're modeling problem solving, right? So instead of panicking and saying, I can't put my shoes on, and throwing them out of anger, he learns, well, I have to put my shoes on, so how do I solve my problem? And so you're teaching children to become self-sufficient, because someday they're going to be dealing with emotional trauma, or they're going to be dealing with huge disappointment. Like your whole life plan was Harvard, 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 and now you find out you get waitlisted at Harvard. Well, now what? Right? You got to learn how to cope with that, right? So, and that's the idea. The idea behind an anxiety trigger is, this is an outcome I can't control, I didn't plan for, and it's disastrous. Well, that's a cognitive block, right? That's a fallacy. So if the source of your anxiety is a cognitive thought process, then you need to retrain your thoughts. If the source of your anxiety is a behavioral problem, then you need to train the behavior. And it's usually a combination of both. It's usually like training thoughts to fix behaviors, right? What is an addiction? An addiction is a behavior, right? But what is it really? It's a craving that drives the behavior. And we mentioned that in some of the classes yesterday, like the idea behind like e-cigarettes and vaping. They came out as a way to help people, stop smoking, because it wasn't just the craving for the nicotine, it was also the oral fixation of the process, right? So that's a behavioral approach. But anyway, let's get into the types of exposure therapies. So inside of counterconditioning, we have exposure therapies and we have aversive therapies. So inside of exposure therapies, we have systematic desensitization. I gave the school example, right? Because here's the reality. We can't just go the safe space route, right? That's the problem, right? If you want to check out a good book on this, it's called The Coddling of the American Mind, right? It was written by, I would call him a demographer, a sociologist. I mean, that's not really his title, but he's written several books. It's called The Coddling of the American Mind. And he talks about this very specific ideology, is that the reason why Americans are suffering more and more anxiety is not because the triggers are changing, but because we actually can't cope with the things that happen to us in our life. So, and it's a failure of parenting, and it's a failure of culture, not just on the parents, but on society. We're not raising resilient kids. We're not raising kids who can problem solve. We're raising kids who are used to instant gratification, and they're not used to, plugging along, strategizing, right? And this is not that new, honestly. If you want to check out a pretty cool experiment on this, there's something known as the marshmallow experiment. Has anybody ever heard of the marshmallow experiment before? There is a brief podcast, I think it's an NPR podcast, on my website if you want to listen to like a 14 or 15 minute explanation of the marshmallow experiment. But the idea is they wanted to test kids who could delay gratification versus ones who could not. And it was a very longitudinal study. I mean, literally decades later from the same kids. And it was a simple experiment. They would tell these little kids, and it's like painful to watch, because these cute little kids are like having emotional crises trying to delay their gratification. So in the first trials they used marshmallows. I think in later replications they even used Oreos. But they told these kids, like, look, here's a marshmallow. We're going to set it on the table. That's your marshmallow. You can have that marshmallow whenever you want. But I'm going to leave, and I'll be back in 15 minutes. Maybe it was 20, I don't know. A long time for little kids. And when I get back, if you haven't chosen to eat the marshmallow, you get to have 2 marshmallows. So it's yours. There's no trouble. You're not in trouble. You can eat it if you want. But if you wait, you can have 2 of them, right? And so then, of course, you're watching these kids agonizing over the marshmallow. Some of them try to smell it. They just bring it up and smell it, and they try to touch it and fondle it, and they sit there and they're staring at it. Some of them eat it instantly. Some of them eat it in a matter of 2 minutes. Some of them eat the marshmallow 4 minutes later, 8 minutes. Some of them make it. And this is what's shocking, y'all. They followed these kids later on, and obviously there's other confounding variables. But of the kids who were able to delay the gratification for something as simple as a marshmallow, they had statistically significant higher SAT and ACT scores. They had higher levels of education. They made more money. They had less arrests, less mental illness. They actually had more successful marriage rates. So whatever caused the I don't know if it's internal, if it's innate, if it's a personality trait or what, but whatever caused the ability to delay gratification leads to fulfillment and success later on in life. And so it's a pretty simple idea that you want to teach delayed gratification if you can. You want to teach coping strategies to overcoming anxiety if you can. You want to teach problem-solving skills. You want to make resilient people, right? So all of these things are kind of interconnected. That's the therapeutic process, is that how do we avoid the panic shutdown and institute coping mechanisms. So that's important to understand. When we talk systematic desensitization, it's not just about making the trigger go away. It's about helping people learn to relax their anxiety in the presence of the trigger, right? So here's the textbook definition. It's a type of exposure therapy that associates a pleasant, relaxed state with a gradually increasing anxiety triggering stimuli. That's what that means. If you think of an anxiety trigger as a hierarchy of triggers, right? There's the actual anxiety producing trigger itself, and then there's all the generalized things around it, right? Because that's what anxiety is. It's the anticipation of what might possibly happen in the future. And it's a control fallacy, right? It's this fantasy to change the outcome to something that we can live with, something that we're okay with, right? So part of anxiety training is cognitive, just learning how to deal with things that you can't control. But part of it is behavioral. It's desensitization to things that will happen to you, right? If you have, for instance, here's a good one, the airplane fear. If you have a fear of flying, here's an example that you might see maybe on a test or something as a type of systematic desensitization for somebody who has a fear of flying. A person with a phobia of flying may first learn to relax when looking at airline ads, right? So they teach you a coping mechanism, and whenever you start to feel this anxiety welling up in you, go through your strategies, go through your coping techniques, right? Baby steps, whatever technique they teach you. Then we're going to gradually increase the stakes here, right? We're going to get you closer and closer to actually getting on an airplane. Maybe it's pictures of airplanes, right? Maybe it's driving by an airport. Eventually, we're going to get to the point where you can enter the airport. Or maybe you go to a museum. That's the example they give. You go to an aircraft museum, and you're able to touch and interact with airplanes, and that's the source of your anxiety, right? It's flying. And you get to the point where you can sit in an airplane, right? Maybe at a museum. It's not running. It's not going to run. You know it's not going to take off. So you buckle in. You kind of go through the anxiety process. You go through your triggers. Or you go, hopefully not your triggers. You go through your coping strategies. And then you get to where, okay, I can now sit on an airplane, I'm good. And then maybe you get on an airplane that's moving, right? Then eventually, hopefully, the idea is that you can get onto a plane that's going to take off, and you can go through your coping strategies, and you can make it through your flight without having a panic attack. That's not what most people do. Most people don't get therapy for their fear of flying. They get on a plane and they take a Xanax. That's what most people do, right? So that's the thing. It's a therapeutic technique for relaxation when you start to feel your anxiety well up. Because the idea is that your emotions are not rational. We need to make sure before this thought becomes an limbic system emotion, we need to catch it and control it while it's still a cognitive thought. We want to keep it here and not allow it to get here. Don't let your cognitive thoughts become emotions. When they become emotions, they overwhelm you. It's no different than rage. What if you have a rage disorder? You have a temper problem. You're going to go through your coping strategy so you don't go off in a blind state of rage. Count to 10, walk away. Do whatever it is you need to do. You're trying to keep this conscious thought from becoming an overwhelming emotion. Because emotions are very real. Anxiety is not fake, but it is debilitating and it's hyper-emotional. It's not logical, right? So it can be detrimental. Another type of exposure therapy is virtual reality exposure therapy, and that means very literally what you think it means. And this is beneficial for people who have phobias or PTSD, right? Because you can create a virtual simulation of an environment, but we're in complete control of it, right? So they're using this with veterans. They can simulate the terrain and the surroundings for the combat zones they were in, but they're in complete control of it. All right, what is PTSD? It is an anxiety, fear trigger for a situation that's overwhelming, that you can't control. So giving you some control in a virtual reality setting helps to alleviate some of that overwhelming anxiety. So that means exactly what you think. But when you see these on a quiz, don't get so hung up on this specific phrasing. Just think about it, right? Counterconditioning is the broad general term to treat these behavioral issues. Exposure therapy is a literal term, right, to expose you to your anxiety triggers. Systematic desensitization, slowly, methodically attacking the hierarchy of triggers, right? Especially for somebody who has like severe panic disorder or they're agoraphobic or something like that, right? So again, virtual reality, it is a safe location. It's not outside of their control. It's not in a public space. It's in a calm, relaxed office. They can get out of the situation anytime they want. It's not like being stuck on an elevator or stuck in a crowded mall, right? It's a safe location. So you can have a virtual reality simulation of walking on a high beam on a building. They use virtual reality for phobias of people who have like obsessive compulsive disorders. If you're a germaphobe, they can simulate environments where you would be, emotionally triggered by something that seems unsanitary. This is a way to create a simulation, but also to control the level of what you have access to. So let's talk about the other type of counterconditioning. So we have exposure therapies, and we have aversive conditioning, right? Aversive conditioning. Averse means bad. We are taking an outcome that's good and hopefully associating it as something that's bad, right? So, again, type of counterconditioning that associates an unpleasant state like nausea with an unwanted behavior. So, aversive conditioning is a good way to eliminate these addictive behaviors that are unconscious, right? Things like biting your nails, right? That's how you would treat biting your nails, would be aversive conditioning. You paint some like nasty tasting nail polish on your nails, and when you get nervous and you subconsciously bite your nails, it tastes disgusting, right? If you can't stop eating junk food, and you can't eliminate junk food from your cabinet, you can make it really spicy, right? So it's painful to eat. So every time you try to eat it, it's a painful experience. It's like pouring, tears from your eyes, and you get to the point where you associate the food with a bad outcome, right? And that's a dumb example, I know, but that's aversive conditioning. Averse means bad. So we want to take something that you want to stop doing, like smoking or drinking, biting your nails, and we want to couple that with a bad outcome. So hopefully, right? Here's an example, right? It's not intentional, but when you drink too much and you get sick and you're hungover, that's the type of aversive conditioning because there's adverse side effects of binge drinking. Now, so that works, right? You swear off drinking. The problem is it doesn't permanently work, right? You have to keep experiencing that to eventually get to a point where you don't want to do it anymore ever, right? So it's not permanent. Aversive conditioning procedure is simple. It associates the unwanted behavior with an unpleasant outcome, right? For example, to treat nail biting, may suggest painting your fingernails with disgusting nail polish, right? And then this is back to Pavlov, and it's back to Watson and this classical conditioning idea that if we associate two things together, we will anticipate the outcome, right? So if we take, a drug that makes you sick, and we add that drug with something that you're trying to quit, like drinking, then basically the addition of the alcohol with the drug, you begin to associate the outcome with the alcohol, right? So after repeatedly drinking alcohol mixed with a drug that produces severe nausea, some people with a history of alcohol disorder develop at least a temporary conditioned aversion to it. And that means that even if they have a chemical addiction to alcohol, this type of therapy can help them, right? Now let's talk about behavior modification. Now we're getting into the Skinner word. This is operant conditioning. Behavior modification is we want to reinforce, it's the law of effect, really. We want to reinforce behaviors that we want to continue, and we want to withhold reinforcement or even punish behaviors that we want to stop. So what do you do with little kids? Like my wife teaches kindergarten, right? So what does she do? Like if one kid is sitting down doing what they're supposed to do, you don't punish the 5, you reward the 1. Oh, look at Susie, she's sitting so well. Susie, here you go, you get a whatever, whether it's praise or a brag tag or something like that. And then what happens, those other little kids, they like crave that attention. So they sit down and they're like, look at me, I'm sitting, look at me, right here, right here. It's behavior modification because you're reinforcing a desired outcome, right? I want you to sit, so I'm going to reward the behavior when you do, right? It's not always punishing bad behaviors. It can be withholding reinforcement, right? So if your coach is always praising you, high five, great job, way to go, Tim, good mechanics on your swing there. So Tim swings and misses the ball and he gets no praise. It's like, well, where's my attaboy? Now, he should get some feedback, right? But that's how you separate instruction from right, like instruction as the form of critique from somebody who's just attacking you, right? Let me give just a shout to the athletes in the room here, right? How do you know if your coach is coaching you or if your coach is attacking you? Well, here's what you do, because emotionally, our first thought is to get defensive, right? Nobody likes to get yelled at. So think about the feedback that you're getting from your coach, right? Is he or she are they addressing a behavior? Are they addressing me? Right? Are they addressing a behavior? Or are they addressing me? If they're constantly yelling at you about your footwork, it's something you're doing. That lady hates me. She always yells at me. Get your feet right. The lady's yelling at you for your footwork. Get your feet right. That's constructive criticism. That's feedback. Now, if your coach is you're stupid and you can't always get this right, obviously that's a personal attack. But probably 99 times out of 100, your coach is not attacking you personally. They're attacking your horrendous fundamentals or technique. So you can't take those things personally. Now, it's a natural thing, but that's how you decipher that. Your teacher yells at you. Your parents yell at you. Are they yelling at a behavior, or are they yelling at me? Right? Sometimes they're just having a bad day, and that's not good. That's not appropriate. They shouldn't just yell at you because they have a bad day. But they're humans and they make mistakes. So you chalk it up as a one-off scenario. Right? He's having a rough day today. Tiptoe around it. Right? But if it happens all the time, yeah, it's personal attacks. It's not good coaching, right? Good coaching is hard critique and criticism, but of specific behaviors. It's behavior modification, right? It's behavior modification. 12 yards means 12 yards. 6 feet means 6 feet, right? Standing right here next to the bag means right here next to the bag. Even with the bag is even with the bag, right? 1 inch off the plate is 1 inch off the plate. Like all this is very, very specific behavior modification. Now, and that's important when it comes to more emotionally charged things like anxiety or addictive behaviors, right? If the behavior is out of some addiction, we have to modify the behavior, right? So that's very Skinnerian, if we can turn B.F. Skinner into an adjective, right? So let's look at behavior modification techniques in actual field research. So one study worked with 19 withdrawn, uncommunicative 3-year-olds with autism spectrum disorder. And again, one of the signs of low-functioning autism in people is late onset verbal speech, sometimes never. So for 2 years, 40 hours each week, that's an intensive amount of intervention, obviously. 40 hours a week for 2 consecutive years, the children's parents attempted to shape their behavior using behavior modification, reinforcing things that they want to continue, withholding reinforcements if not. They positively reinforced the desired behaviors and ignored or even punished aggressive and self-abusive behaviors. Well, what happened? The combination worked wonders for some children. By first grade, 9 of the 19 were functioning successfully in school and exhibiting normal intelligence. All right, that's not all of them, but that's significant because that would not have happened otherwise. In a group of 40 comparable children not undergoing this treatment, that's your control group, only 1 showed similar improvement, right? So that's a drastic change. But that's a lot. That's invasive. That's intensive, right? But that's behavior modification. It can work. Now, here's a fun vocab word, is a token economy. You're going to see this maybe in FRQs. You're going to see this on test questions in the future. A token economy is a type of behavior modification where you're given incentives as rewards, secondary reinforcers, right? You get a brag tag, and if you get 10 brag tags, you get to, right, I don't know, get something out of the treasure box. That's a token. Token is some secondary reinforcer that has no real value, right? Operant conditioning procedure in which people earn a token, a chip, a stamp, other non-monetary item for exhibiting a desired behavior, and they can later exchange those for privileges, right? So anyway, that's a token economy. 2 criticisms of behavior modification, right? Again, when it's addiction, can you just modify the behavior? Probably not. It may be deeply rigid, right? How durable is the behavior? where people become so dependent on extrinsic rewards. Remember, that's the over-justification effect, that the desired behaviors will stop when the reinforcers stop. So, is it right for one human to control another's behavior? There's an ethical concern here, right? Kind of this libertarian idea of like, if you don't want to change your addictions or your destructive behaviors, should we have the right to intervene and stop you? Those who set up token economies deprive people of something they desire and decide which behaviors to reinforce. And to critics, the whole thing seems very authoritarian, right? So in other words, you don't really need to incentivize kindergartners to behave right. They will do it anyway, right? That's one of the critiques. All right, so we'll get into the cognitive forms of therapies again. So we have behavioral therapies. That's counterconditioning. That falls into two categories. You have exposure therapies and you have aversive conditioning. Inside of the exposure therapies, you have systematic desensitization, virtual reality exposure therapy, and aversive conditioning is just what it is. It's the way to modify unwanted behaviors by punishing you with something that's an aversive response. We'll get into the cognitive therapies, which is like group therapies or positive thinking, right? And then we start combining both of them together into cognitive behavioral therapy, which is what we talked about with the cognitive distortions.